let go and I'll hold you up. So hold me tight and close your eyes.
Good morning, good afternoon, and good evening, ladies and gentlemen. Welcome to this webinar, Tracking the Effective Coverage of Large-Scale Food Fortification, Introduction to the FORTIMAS Methodology. So my name is Saskia Osendarp, and I'm the Executive Director of the Micronutrient Forum, and we are delighted to welcome you to the conversation today, which is organized by the European Union Food Fortification Advisory Service, TUFAS, which is an advisory service that is funded by the EU and implemented through a partnership between Landel Mills and the Global Alliance for Improved Nutrition or GAIN, in partnership with the Iodine Global Network, IGN, and the Micronutrient Forum. So this webinar is being live streamed on the GAIN YouTube channel, and a link to that channel will be put in the chat now. In today's program, we will introduce you to the FORTIMAS methodology, which can be used to track effective coverage of fortified foods. And we will take stock of some recent experiences in countries where the FORTIMAS methodology was used and implemented, and where progress was made in adapting the methodology to various food vehicles. We have a panel of esteemed panelists that will present this methodology to you and present why it was developed. It will share the basic concepts and premises of the FORTIMAS methodology, and it will illustrate the necessity of ongoing public-private sector engagement towards documented, sustained coverage of large-scale food fortification programs. We will also summarize findings that are based on the adaptation of the FORTIMAS methodology in 2 countries to date, and we will learn from the Iodine Global Network on why and how they tried the FORTIMAS methodology and how they intend to implement this methodology for assessment and tracking of salt iodization programs. As part of today's webinar, we will have 4 speakers, and we will have 2 Q&A sessions to cover the content and to begin to address your questions on this methodology. So throughout the webinar, we encourage you to put your questions in the Q&A box that you can find on the bottom of your Zoom screen instead of in the general chat. And those questions that are put in the Q&A box will be shared with the panel during the Q&A sessions of the webinar, or if time does not permit to address all the questions, we will aim to answer them in the Q&A chat. So with this brief introduction, I would now like to ask 2 individuals to formally introduce this webinar to you. The first is Fadoy Shahouki, who is a policy officer at nutrition at the European Commission. And the second is Christophe Guyondet, who is team leader of TUFAS. So over to you, Fadoy.
Thank you, Saskia. Good morning, good afternoon, everybody, and thank you for coming for this webinar. So my name is Fadoy Shahouki. I'm a nutrition policy officer at the European Commission for International Partnerships, so INTPA. And the European Commission is engaged in the fight against all forms of malnutrition, including micronutrient deficiencies. We believe that food fortification is an efficient tool to fight against this kind of malnutrition. We actually fund several programs of food fortification through our different partner countries. And for us, it is important to check and be able to follow up, to monitor the impact of those programs and the impact in general of food fortification. That's why it is good to have such a tool as FORTIMAS. So thank you for coming, and I will hand over to my partner, Christophe. Thank you.
Partner in work.
Yes, of course.
Thank you, Fadoy, and again, very welcome to everyone, and thank you for taking the time to join us and take part of this webinar. We hope it will be informative for you all. My name is Christophe Guyondet. I'm the TUFAS team leader. TUFAS, for those who don't know, has been set up as a partnership of GAIN and Landel Mills, like Saskia mentioned, back in December 2015. So we have just over 6 years of operation. our mandate is essentially to backstop the food fortification projects funded by the EU. We have three main priorities. One is to increase the action and political commitment to food fortification at the global and national level. And recently, the European Union has made a significant commitment to nutrition, which we believe we contributed to through our work over the past 6 years. Our second priority is to support countries and delegations in implementing their food fortification program through technical assistance. We have a roster of consultants that work with TUFAS and have been dedicated to help countries in the implementation of a number of fortification projects. And third, we aim to share knowledge, lessons learned, and best practices around food fortification. And it is really in the framework of this last point that we have decided to host this webinar today to present to our delegations, but more widely to the fortification community, if I may say, a methodology, the FORTIMAS methodology, that we believe is not only just cost effective, but it's also logistically easy and practical to implement in order to monitor food fortification programs. And the timing of this webinar is particularly relevant for us at TUFAS and the EU, because 6 years ago, the EU funded 10 projects, 10 fortification projects in 8 countries across Africa, in Chad, in DRC, Ethiopia, the Gambia, Kenya, Madagascar, Niger, and Sudan. And these projects, they're all coming to an end at the end of this year. And so they're reaching this critical stage in the lifetime of any given fortification project, where donor funding will be ending, but we'll still obviously need to continue to mobilize interest, to mobilize commitment and resources for fortification to continue and to sustain the actions that were implemented in the past 6 years. So one of the ways, I believe, to continue to mobilize interest and resources is to show impact. It's just as simple as that, to show that there is improvement in micronutrient status, that quality fortified foods are on the market, and that there is effective coverage of this population. And as Fadwa mentioned, this is what this workshop will be about. Let's present to you this methodology, what it is, how it's been implemented in various countries, and how it's been adapted to various food labels. So with that, I'm just going to end now. And thank you again for joining us. And I hope that you'll be able to learn about the methodology today. Thank you.
Yes, thank you, Christophe, and thank you, Fadwa, for this introduction. We will now move to the webinar, which has been divided in 2 sections. In the first one, we will give you an introduction to the FORTIMAS methodology. This will be given by Quinton Johnson and Ibrahim Parvanta, whom I will introduce. And that will be followed by a brief Q&A section. And then we will move to the second section of the webinar, in which, as has been indicated, 2 people from IGN will present country experiences in using this methodology in a country setting. So I would like to introduce now Quinton Johnson to you. He is a fortification consultant at Quinken Inc. And he's a professional with over 32 years of experience in new product development, in quality assurance and in regulatory affairs in the food and medical device industries in North America and the United Kingdom. But his main interest is in the milling and baking sectors of the food industry. He also provides consulting services to the United Nations, to national donor aid agencies and international NGOs on staple food fortification. And he will share with us why Smarter Futures supported the development of this FORTIMAS methodology. Over to you, Quinton.
Thank you. Good morning, everyone. Good afternoon, good evening in some parts of the world. Thank you for your kind introduction. I would just like to add that FORTIMAS came about as a result of a number of discussions with the late Anna Verster. And Anna was a senior nutritionist within WHO. She retired and joined Smarter Futures. And in fact, she was the main driving force to get the funding for Smarter Futures, which is fortification programs in Africa. Anna was getting frustrated by the fact that we had no idea as to how well the fortification program is being carried out. And Abe worked on a methodology, and it has been used in a number of countries already. And from my perspective, it was a deal breaker, and I would like to then move on to my next slide, please. So the FORTIMAS stands for Fortification Monitoring and Surveillance, and it's an acronym developed by Smarter Futures and helps answer the question, is micronutrient status of people who regularly consume sufficient quality fortified flour improving? And the sufficient has an asterisk with it, which is based on an estimate of per capita flour consumption. It can also be easily adapted to track other food fortification programs. And so I can then move on to the next slide, please. The reason that it was developed was when fortification food, staple food fortification started to be adopted at the global level, the nutrition community wanted to see nutrition impact as soon as possible. And sadly, little attention was paid to the status of a fortification program at the industry or at the supplier level. There was lack of information on availability and distribution of fortified foods. And in order to make sure that that people had some indication of an impact, a tool using national nutrition surveys were carried out at great expense, which was designed to show impact at the population level, but didn't take into account and doesn't take into account the lack of knowledge on the lack of distribution of fortified foods in the country. And so FORTIMAS was developed to assess and track micronutrient status at the population level in combination with the status of fortification in fortified food sectors. Can I have the next slide, please? What can it do? It can give a snapshot on the status of the supply and distribution of quality fortified foods in the country. Definition of qualified foods, that it meets the standard of a fortified food by developed by a country or even at the regional level. And one of the key aspects of it is that the use of sentinel sites, and I will leave Ibrahim Parvanta to talk a little bit more about that. On the supply side, the food industry, particularly in the registered food industry business, acts as the sentinel sites on the supply of fortified foods, and following good food control and food practices by the Food and Drug Administrations and the government, they can have a good idea as to whether the food industry is actually following the standards and providing the food as specified in the regulations of a country. It can be applied to assessing effective coverage of any nationally produced and imported food. And using the data of the quantity and quality of fortified foods, countries can determine coverage of the foods to see if the food is sufficient to improve the micronutrient status of the population. Countries can determine at relatively modest cost the status of a fortification program without always resorting to expensive national nutrition surveys. And that was basically the work that Abe has put together. And at this point, that's the end of my opening remarks. And I would just like to add that it was certainly far-sighted of the late Dr. Anna Verster in helping us to fund and develop this program. So in memory of her, I'll pass this over to Parvanta. Thank you very much.
Thank you very much, Quinten, and very much appreciate your memorial for the late Anna Verster, whom we all hold close to our hearts. I would like now to introduce Dr. Ibrahim Parvanta, or Abe, as he is also being called, in case you were wondering whether this is the same person. Yes, it is. So he's a public health nutrition professional with over 30 years of technical and leadership management experience in the United States, as well as holding advisory and consulting roles in more than 30 countries. So he is experienced in the development of policies and strategies related to the prevention and control of micronutrient deficiencies, vitamin and mineral deficiencies, strengthening maternal and nutrition and child nutrition programs through evidence-based interventions and technical and program capacity development, and designing and implementation of feasible and ongoing data systems for monitoring and surveillance of the quality, coverage, and the impact of public health nutrition interventions. And as such, he's very qualified to present to us the FORTIMAS methodology and to give some of the basic, share some of the basic principles of this methodology. Over to you, Ibrahim.
Thank you very much, Saskia, for that kind introduction. And thank you to Quinten for mentioning and our dear colleagues, former colleague Anna Verster, the late Anna Verster, who really was, as Quinten said, the force behind our effort to develop this methodology. So just hello and greetings to everyone. And today I want to give you a brief overview of the FORTIMAS methodology, kind of at a very, global level, at the very high level, not into a lot of the details, but hopefully during the Q&A sessions, we can have some further discussion on that. So my plan is to present to you the broad premises of the FORTIMAS methodology, to explain a little bit more about what sentinel data collection is based on in the methodology that we have developed, and then to summarize some of the benefits of the FORTIMAS methodology. Next slide, please. So this diagram, referred to as the FORTIMAS formula, summarizes the first and overarching premise of the FORTIMAS methodology and illustrates a systematic approach to monitoring and surveillance of a food fortification program. As you note in boxes A and B, it requires public-private sector collaboration to first confirm the consistency of quality and sustained high coverage of a target fortified food over an appropriate length of time, as shown in box C, before looking for the nutritional impact of the intervention shown in box D. And in principle, this methodology, this approach would be then continued over time. And as Quinten mentioned, the aim of this was to try to help countries avoid expending resources on doing large surveys or evaluation surveys at a time or a place where such impact might not be evident. Next slide, please. The second premise is that with sustained high population coverage of a fortified food, findings on the micronutrient status using a non-representative population data would be reflective of the situation in the broader population. As illustrated by this example from Oman, since the start of that country's mandatory flour fortification program in 1996, the declining trend in anemia prevalence among a non-representative first trimester pregnant women who sought antenatal care services is reflective of the trend in anemia prevalence based on 3 representative surveys of non-pregnant women of childbearing age that were conducted in the country in 2000, 2004, and 2008. Next, thank you. So the third premise that we have to keep in mind is that the aim of the FORTIMAS methodology is to assess and track effective coverage of a food fortification program as a public health intervention. It is not to carry out a cause-effect research study. Next slide, please. The fourth and kind of final broad premise of the methodology is that the triangulation of information using reliable complementary data through different sources enables better assessment of the fortification program as a whole. This diagram is to illustrate an example of triangulation of information related to a hypothetical fortified flour program. Essentially, this part of the diagram shows that relevant information from flour producers, importers, and wholesalers, as well as relevant government authorities such as the Ministry of Industry, Ministry of Commerce, or Food Control Agency, could be used to estimate the amount of fortified flour available in the country. And based on that, calculate the overall, what referred to as expected population coverage of the product. Then, with the collaboration of the private sector, the market distribution of the fortified flour would be mapped to identify subregions of the country likely to have close to 80% or higher coverage, population coverage of the product. Next, please. So, and then among the subregions where the annual population coverage is expected to be high, population level data could be collected to confirm the high coverage if needed. And you've noticed that I've said if needed, because if the collaboration with the industry is good and the data, the available data from those sectors are reliable, then it may not be necessary to confirm it. But if need be, that the FORTIMAS methodology allows a rapid way to assess or to confirm the high coverage before moving on. So next, please. Now, after the high fortified flour coverage is sustained for at least a 1-year period, and that's the key other part. If you think about a bit of time of the intervention, then a round of surveillance data on feasible impact indicators would be collected. And without going into too much detail at this point on it, I just want to bring to your attention that in many low and middle income countries, data on hemoglobin test results on first trimester pregnant women and neural tube defects affected pregnancies are already available in relevant health facilities and could be systematically analyzed and reported over time as impact indicators of that flour fortification program. Of course, we have to keep in mind that for subregions where low coverage of fortified flour is expected, we don't forget about them. We have to develop appropriate strategies to see how to increase that coverage before looking for impact in those areas. Next slide, please. Now, we've talked about sentinel data or sentinel sites, and so I just want to give you a little brief overview of this. The term sentinel comes from the French word sentinelle, and I hope I've pronounced that correctly in French, which means a sentry or a watchman. And as you would imagine, the location where a sentry, a guard, if you will, is posted to watch for potential danger is not randomly selected. Instead, the location of the post of that guard is purposefully chosen to enable the sentry to most easily identify a potential threat and sound the alarm. Now, in public health, sentinel population refers to an at-risk or susceptible population that is monitored or watched over for the appearance or recurrence of an expected outcome. And this methodology really kind of developed through the infectious disease programs, but it can be obviously used it has been adapted to other public health interventions. In the FORTIMAS methodology, the basic premise is to first, we need to identify sub-geographic areas of a country with high population coverage of the target food, and then so that we can purposefully, with the help of the food sector, the fortified food sector, we would purposefully select those particular subregions for population level data collection, because that is where the impact is likely to be detected. A sentinel site, on the other hand, refers to a community within that large subgeographic area where the population data would be collected. And then we came up with the term data collection point, which refers to a sentinel, a setting or a facility, for example, a health center, a hospital, a school, in a houses of worship, where within those sentinel sites, where target subjects could be efficiently recruited for data collection using convenient sampling methods. Next slide, please. Next slide. Okay. Oh, sorry. Go back when I missed it. Sorry. And then finally, just to give you some ideas about some of the benefits of the FORTIMAS methodology based on the experiences to date. First of all, countries could implement it on their own without too much external technical support. Furthermore, it allows for fortified food producers and importers, as well as the relevant government agencies, aside from the Ministry of Health, to understand how their data is important in tracking the population and the population's nutritional status. And I want to emphasize this a little bit more, because in many countries that I've been working in, and I think my friend Quentin would attest to this, the fortified food producers often kind of complain that their efforts are not adequately acknowledged by the public health sector. So we have to be cognizant of that and really try to recognize them when they do the job. So the other point is that it's with these limitations considered, each round of FORTIMAS data collection, based on our experience so far, costs substantially less than a typical representative micronutrient survey. And then the other point is that it could alert the fortification program stakeholders of changes in the market distribution of fortified food that might impact a population's micronutrient status. So, for example, in South Africa, as I recall, when they started the program and back in early 2000s, the law went into effect to fortify bread flour, but over the number of years afterwards, the proportion market share of cake flour, which was not required to be fortified, increased substantially, and that kind of affected the market contribution, if you will, of the bread flour, and that was not, it would have been easily detected through the FORTIMAS methodology if we had it at that time.
Can you please wrap up, Ibrahim?
Yeah.
Thank you.
Yeah, I'm almost, just about finished. And finally, we could help, help also use, because we use data from the public health sector, it could help improve the utility and quality of the health statistics data. So with that, I thank you for your time.
Thank you very much, Abe, for this very interesting and very clear introduction to the methodology. And we are now have a few minutes for Q&A. So you haven't submitted any questions yet in the Q&A chat, so please feel free to do so. The chat can be found in the bottom of your Zoom screen. But in the meantime, I would have a few questions for both speakers, actually, for Ibrahim and for Quentin. And the first is about this Sentinel methodology, and I think that's a question for you, Abe. How can we interpret this population level data, especially since you already indicated that these are to be selected based on high coverage of fortified foods, which makes sense if you want to know something about the impact of the program. But from a needs perspective, they may not necessarily overlap, correct? Oh, you're muted, sorry.
Sorry. I think there are two aspects. So first of all, I mean, the key is to look for where there is impact. I mean, even if we did a random representative survey, depending on how that survey is designed, it may or may not pick up the level of impact. So the first thing is to look for where we think there is impact, because the aim is to start showing some improvement. And theoretically, even without looking for biochemical measures or laboratory measures of impact, in principle, if we have adequate quantities of the quality of the adequately fortified flour, enough for people to eat on that level that, as Quentin mentioned, if they're eating it at, it's accessible to them at the sufficient levels, in principle, their status should be improving. But here's the other part, that with Sentinel data, because it is not representative, it's a reflective data. So the interpretation we have is that it helps answer the question, is the situation improving among that population? It doesn't tell, it's not designed to say, this is the level of micronutrient deficiency. So we don't say this is X% is deficient. We say, this is, here's a pattern of what is happening. And I think that's the limitations, if you will. But as finally, I guess I would say that, as I showed you the example from Oman, those patterns were very, very similar. Now, the pattern was the same. Now, the levels of anemia, for example, that was reported from the survey versus their surveillance system were slightly different, but they were not so different that you would make any different policy decisions.
Right, thanks. And I'm sure this will come back later on in the discussion as well. We have a couple of questions in the Q&A chat, and I'm reading them out to you. The first one is from Louise Aboyomi. Thank you very much, Louise, for your question. And it is about, this methodology really requires, in addition, to strengthen national capacities in general in food fortification, but particularly also in product testing, in fortification process validation. And I think some of the data that you used also require strengthening national capacities, for instance, in labs. So these are not always synergistically being addressed in across countries. So what solution would you propose? And maybe that's a question to Quentin as well. And I also realized that we may partly address this question later on as well when we have the opportunity to listen to two countries with, based on their experiences.
Quentin, why don't you go first?
Okay. The issue around labs is an important one. And the capacity to measure, particularly iron, is relatively strong because it's the methodology is atomic absorption and methodologies. When it comes to measuring folic acid, that's a bit of a challenge, and it requires HPLC technology. So given a choice for national labs to be able to measure the quality of fortified flour, and knowing that the premix contains more than one micronutrient, it would include ions, or sometimes zinc, but it also includes B1, B2, B3 maybe, and folic acid. So in a way, what you can do is, if there's strong capacity for measuring the metals in foods, you can use that technology to determine as to whether the flour is adequately fortified quantitatively and at a relatively reasonable cost. And one of the other points that I would also add is that if governments want to measure all of those micronutrients, that's a big expense to be able to do that. And it's much better to, in effect, use iron and or zinc as the marker to determine that the addition rates have been followed by the flour mills. So,
yeah. Thanks, Quentin. That also addresses in part, at least, a question that was also raised in the Q&A chat by Robert Asidou, who was asking about the costs, and he was suggesting that this is mostly expensive, so the poor cannot afford. I think based on this question, he was maybe referring to fortified foods and not so much to this methodology. But as you said already, this methodology comes, of course, at some cost, but it is always less expensive than the alternatives of doing a full survey.
I would just like to add that there's an important quality control tool that millers use when it comes to assessing the addition rate of the premix in the flour as it is being milled, and that's a check weighing step, because the millers always know exactly how much flour per hour, how many tons per hour are being produced, And from that, they can determine how many grams of premix need to be added. And that's, there's two methods that they use, one in combination, and one is to check weigh the feeders to determine that so many grams per minute is being added to meet the standard. And secondly, there's a very rapid spot test that the millers can use to determine that it's actually there as well. And they can compare the spot test to a standard sample, and they can say, yes, okay, we're following it correctly.
Yeah.
If Saskia, if I may make another comment, and just in here, this is what I've learned from Quinton. People, I'm a nutrition person, not an industry person. And one of the things I've learned over the years is that, you see, that one of the key things that we have to think about, even with testing of products, is that we're looking, as I mentioned, the aim is to see what is the consistency of the quality, not that quality at that one point that the product is tested, but the batches, large batches, or over time. It has to be consistent. And so as Quinton said, one of the tech tools that or methods that is used, at least as I understand, in the United States or Canada, for example, even by the food producer, not just millers, fortified food producers, but also for the regulatory agencies, is what they call a premix reconciliation tool, where they look at the use of how much, they look at how much premix was used, how much flour was produced, they look at the records. And based on that, they can make a good estimation of whether the product would have been adequately fortified. And then the testing is just to verify that the process is good. It's not the actual test of the product. The test is based on this on records, records.
Yeah. Thanks. There are a number of questions in the chat that actually all relate to countries that are interested in applying this methodology in their country, and they would like to know where they can obtain more information. And there's a general question by Dora Panagidas in how many countries have already used this methodology. So would you have a quick answer to that question, and then also maybe a quick answer on where countries that are interested in this methodology can find more information. And we will have a second Q&A session at the end of the second section of this webinar. Just want to remind everyone where we will try to address as many of the questions in the Q&A chat that have not been addressed in this session. So please hold your breath, because your questions will hopefully be addressed all in this session. But maybe first over to you, Ibrahim, to give a brief overview of the number of countries that have already used this methodology, and maybe also where interested country representatives can find more information on this methodology.
Okay, so far the number of countries are not that many, but we have the methodology has been implemented in the Republic of Georgia and Republic of Turkmenistan, and at least in the first rounds, it's just because the methodology is not all that old, it's relatively new. So, and it worked very well, at least based on experiences. And my colleague Gregory will be speaking about these experiences a little bit. It is currently we're working to implement it in the Gambia. It's called the Gambia. They refer to it as the Gambia FORTIMAS system. So that's where we're working, and there's some pilot round of data collection that shows relative, good ability to do it. And so those are the three countries where there's some work has been done. As far as getting information about the methodology, obviously people are happy to, I'm happy to answer people's questions, but the Smarter Futures was the group that, funded the development of the methodology, and the document on the flour fortification component is available on on their website. And we're now working, as Arnold will be speaking, to adapt that to USI or saltization. Yeah.
Thank you very much. And for now, we will close this part of the Q&A session, and also close this first part of this webinar. And we will move on to where we will hear more and learn more from country experiences, as Ibrahim already introduced to us, where we will hear from two speakers that will present to us taking stocks of lessons learned, and also some challenges and areas for future development. And we will first hear from Gregory Gerasimov, who is the regional advisor for Eastern Europe and Central Asia of Iodine Global Network, and then Dr. Arnold Timmer, who is a senior advisor from IGN. So Gregory joined IGN as regional coordinator in 1992, working through a network of national representatives in countries of Eastern Europe and Central Asia. And he's supporting the monitoring of iodized salt coverage, population iodine status, and the sustainable elimination of iodine deficiency. And Gregory will discuss with us the experiences of using the FORTIMAS methodology in two countries of IGN. Over to you, Gregory.
Thank you, Saskia. Yes, indeed. And we were talking about the experience which we made from the Republic of Georgia and from Turkmenistan. Next slide, please. So next one. Yeah, so first of all, the Republic of Georgia, just a little bit overview, is a country in the South Caucasus with a population of 3.7 million. And it's a mountain country with about 80% of country covered by hills and mountains. And it was historically quite iodine deficient, with some cases of endemic goiter and endemic cretinism in the past. So the country has a national legislation which prohibits production, importation, and trade of non-iodized salt, which is strictly enforced. So it's a country which is importing only iodized salt, and it has no local production. So the salt was coming from several countries, and in 1916, the Ministry of Health decided to implement the system which they call Georgia Nutrition Monitoring Surveillance System, based on FORTIMAS model, tracking iodine status, anemia, and neural tube disease, with support of US CDC. I must say that it was mentioned before, FORTIMAS is meant for tracking status of more than one micronutrient. But in this presentation, I will specifically focus on the results of iodine status and use of iodized salt, because that is more close to my studies. And then the second, because they get, I think, in my opinion, very interesting results. So the first round of data collection was conducted in antenatal care facilities in 4 sentinel sites. And we should mention that it was specific. It was not like an assessment in a way how we know it. It was these antenatal care facilities where pregnant women, where children were coming, on a regular basis. So they were, all of them were under, it was a part of normal evaluation of pregnant women, which included a collection of blood samples for HB, hemoglobin analysis, and also a urinary analysis. But of course, the part of the urine which was collected for clinical analysis was frozen and then sent to laboratory to measure the content of iodine in it. It was, of course, not done in a sentinel site. It was done centralized. And then in 2017, a separate national representative iodine status survey was conducted. Next slide, please. So first of all, this is a map. It's a little bit too down, but you see it's a country, in the South Caucasus. To the north is Russia, to the south Turkey, Armenia, Azerbaijan, to the west Black Sea. And there are 4 sentinel sites, which are 2 of them in Tbilisi and Batumi. They are in urban side, and 2 of them are in rural side, and they are more or less evenly spread over the territory of the country. Next, please. So the first thing was, the results of iodine testing. So in this case, we were not able to make quantitative measurements of iodine. So we decided that we will use rapid test kits instead. So, and you see that on that, all salt samples, they have blue or kind of dark blue staining, meaning that all salt in that country, all salt which the participants brought, were all iodized in, except one on the right slide, which is number 9. But we still think that even this salt was iodized. It was just fortified, not with potassium iodide, but iodide, and delivered from the neighboring country. And that's why it was not stained by the rapid test kit. Next, please. So this is the cumulative results from Sentinel survey of 2016 and the national survey of 2017. The reason the national survey was conducted because the government was not kind of completely sure that the results which we had from Sentinel site were enough to warranty the situation in the country or to plan some future action. So basically, put it honestly, they didn't trust the results because there were only very few samples collected. But look at that, the household salt coverage in both surveys, it was shown that it's extremely high. It's almost 100% of all salt in this country is iodized. And moreover, 97.6 is adequate iodized. The median iodine level in salt was almost 33 milligrams per kilogram, which is completely adequate, good within the national standard of 25 to 55 milligrams per kilogram. And then look into the median urinary iodine concentration. In school-age children, on Sentinel sites, which were only 91 school children, and school children, then there were more than 1,200, it's basically the same results, 293, 298, both of them are in a normal range close to the upper level. In pregnant women, almost the same, 47 and 634, the results are basically the same, or close enough just to make any kind of policy decision, which in this case saying that everything is going well in this country. And next slide, please. So another country was Turkmenistan, and this is another country situated in Central Asia, bordering of Iran and Afghanistan and Caspian Sea on the west, of population 4.5 million, unlike Georgia, is mostly covered by deserts. And the early survey in the 1990s showed mild iodine deficiency. They also have national legislation which prohibits production and importation of iodized salt. The good thing is they have their own salt production, and not only they produce their own iodized salt, this country has also production of potassium iodide. So they basically completely self-sufficient. And the national survey first, which was conducted in 2004, also showed 100% household coverage and optimum iodine nutrition. But then for a long period of time, there were no national status survey, but periodic national surveys like DHS or MIX showed still high household coverage. So again, in 2018, the Ministry of Health, with support of UNICEF, decided to implement FORTIMAS. And again, to cover the same thing, the iodine status, the anemia and NTD. And the first round of collection was conducted in 2018 and then presented in 2019. And next slide, please. The same thing was 11 Sentinel sites. So this is a little bit kind of odd slide. On the left, there are results, there are description of the sampling method. On the right, this is the results of 2004 national survey and the map of the country with the name of different regions. So on this right slide, you see that it was optimal iodine nutrition, and it was optimal not only countrywide, but also on all the regions. So again, it was 11 Sentinel sites, 2 in each of regions, Velayas, 1 in urban, 1 in rural site. Also, there were additional site in the capital city, Ashgabat. So there were same model. So the pregnant women were coming to their antenatal clinic, and the urine samples were collected for clinical purposes. Part of them were frozen, sent to the central laboratory. Also, all women brought with them a sample of salt from their households. And in this case, they were also sent to the central laboratory, and they were measured. There was a quantitative measurement of iodine in salt. Next slide, please. So what we had with regards of salt, we found out that, first of all, the estimate capita salt intake, we were like a little bit conflicting data, but we found out that the estimate per capita salt intake in Turkmenistan is very high, 17. And with the iodized salt needed annually, the calculation was almost the same as iodized salt produced. So basically the predicted and the real production was basically the same. An expected population coverage with the salt which was produced was over 100%. That, I mean, taking all the errors of these calculations. Next, please. And so again, what we found out, it was amazing results that in all the regions of the country, there were 290 samples, all of them, all 100% of household coverage were iodized salt with a median level, which were also well within the range, for the standard 25 to 55. So there were only very few samples which were below, 25 or 15 microgram, milligram per kilogram. So next slide, please. Well, then at the same time, we had a trouble with the evaluation of iodine status of population. Well, when the results from laboratory came and they see that they are quite low, in all the regions, that is less than 100 microgram per liter or less than 150, which is a lower threshold for optimum median urinary iodine concentration in pregnant women, we see that something is completely wrong. It cannot be like that. With this level of salt iodization and coverage, it couldn't be like that. Like, for example, the same level in Georgia, it was 211. So we thought that, and we proved that it was laboratory mistake. Next slide, please. So, as we said, there were no, so, well, we must say that experience of Georgia and Turkmenistan showed that FORTIMAS proved quite reliable for tracking progress in universal salt iodization. Of course, you may say that these are two countries which had an incredibly good salt iodization program with 100% coverage. So it may be different in the countries which have the patchy kind of results in salt iodization. Well, the FORTIMAS approach is really, really substantially less expensive and logistically much simpler than conventional representative survey. We have like an estimate that, for example, in Georgia, the Sentinel survey, the price was somewhere around $15,000 for covering everything, including laboratory. The subsequent national survey was 10 times more expensive. 10 times more expensive. Well, and what is important also that the assessment of macronutrient status of the population groups should be embedded in the existing system of primary health care, which will tremendously simplify the procedures and reduce cost of data collection. Well, at the same time, there was also the question about that, of course, that and other method of data collection. The FORTIMAS methodology requires very reliable laboratory capacity for assessment of macronutrient status. And we saw that in one of our examples, then the country like Turkmenistan failed to do that in a proper way. And therefore, we think that is one of the main obstacles to implementing FORTIMAS worldwide. Thank you.
Thank you very much, Gregory, for this very comprehensive overview of how FORTIMAS has been used in these two countries, and also to already identify some of the challenges and that still needs to be thought of and overcome. We now will hear from Arnold Timmer, who is a senior advisor at the Iodine Global Network. And Arnold's role within IGN is to support activities in South Asia and West Central Africa, as well as to help further shape the strategy of IGN. Over to you, Arnold.
Yeah, hello everybody, and it's very good to see many country colleagues participating in this webinar. And I'm going to talk a little bit about the why. Actually, you would say, why didn't you start with that? I think when you listen to the different sessions, you'll realize that, but why do we need really this FORTIMAS methodology? And I'm just going to shed some light on a long established program of salt iodization where we run into problems around the data tools that are available, which is basically surveys and other routine monitoring. And let me share some experiences. Next slide. So we have done quite a lot of iodine landscape analysis. I'll talk about that, and then some challenges about the data requirements and the value that we think FORTIMAS can provide to monitoring in iodine programs. Next slide. So this landscape analysis or program reviews, we use that tool to look at the situation of iodine programs, identify challenges, and to formulate actions. And to date, we've done it in 63 countries in Africa, South Asia, Eastern Europe, and Central Asia. And mainly done, by the way, during COVID times. So a lot of the distance work was done and showing the virtual tools and the effectiveness of those. This year, we continue in the Middle East and also some countries in East Africa and Southeast Asia. So the results actually provide us up-to-date information on the program scale and on iodine status, but also looking at the equity dimensions, because once programs come to maturity, we see that the focus should be on those that are not being reached. And also challenges in different program domains. And by that, I mean, you can think of legislation, you can think of supply side, you can think of management and coordination. The analysis also looks at regional aspects of trade, the role of regional organizations, and collaboration between different countries. And important, the process actually helps to engage stakeholders and to re-energize focus on iodine programs, because as I said, there have been long-standing programs and there's been some fatigue in this. And the green arrows, you see the different steps that we take. We do the landscape analysis, we have country workshops, they then define a country action plan or some actions, and then hopefully, and to some extent, most of the countries start with implementing these actions. Next slide. So let me share an example. So in the purple boxes, you see the challenges that are identified, and we distinguish two different aspects to this. There may be issues with the design of the program, meaning, are we actually doing the right thing on paper in terms of the level of fortification, or how we're going to work with the different industry partners to reach the population, and also looking at how to improve the program implementation itself. If you can click once, thank you. So this is a very busy picture, but I want you to look at the yellow boxes first. So you see a flow from the salt supply side on the right. We distinguish basically, just like with other fortified foods or with other foods, that salt, you have salt that's not iodized, salt that's poorly iodized, or iodization that's not being sustained. Those are the main three problems that we identify. Of course, we want to then see it translated into adequately iodized salt that's either used for animal salt, for food salt, or for table salt. And then if you follow the arrows up, that salt is then being consumed and then leads to an iodine status, not just for everyone, but also for different population groups in different areas of the country. In the center, you see the central coordination, the legislation, which is basically the tool that governments have and to enforce that, to implement the fortification program, iodization program. What's very important is that we need to know where the problem is in order to come up with a solution. So what we then did in this landscape analysis, the blue boxes basically are identifying the different challenges that were observed. For example, there's a low awareness among suppliers in low use areas of why they need to do this. There's a low compliance, the issues with the salt quality, there's non-iodized salt leakage into the market, the quality of iodization, but also in the low use areas, there's not a high awareness in this particular example. If you can click once more. So the red boxes I encircled basically to identify those challenges that relate to data or monitoring. Next slide. So we did then some analysis of all of these different landscape analysis. And on the left, you see some of the main observations. We see that data is mainly available from national surveys. And it does not tell us enough about the program mechanics. How does it work? The routine monitoring systems that are put in place, but they are hardly functioning and often not very accurate. And it really leaves the program manager blind as to where the problem is, its magnitude, how to fix it, and how to track the corrective action. We often see that supply information is very sketchy, if available at all, and the equity dimension is often not reflected. We don't know who's not being reached. And on the right side, you actually see a typical household coverage survey data over time. And you see that the trends are going upwards. But in this country, the only conclusions we can draw from this is that 80% is a number we have. We know that then 20% of the population is using non-iodized salt, but we can't really tell what percentage is using poorly iodized salt and what percentage is using adequately iodized salt. So this is a typical data we get from surveys. Next slide. So what do countries actually measure? We get national averages from the surveys, and they hide inequities. We saw that 90% of countries that had an adequate iodine status nationally, half of them actually had deficiencies at subnational level. And less than half of the countries look at the iodine status by intervention, by iodized salt coverage, what is happening with flour fortification, for example. And only one third of the countries look at the iodine status by wealth quintile. So to really see how are the poor, the medium, and the rich population groups doing in terms of iodine status. And also we see that processed foods, or the salt used in processed food, is not really being considered at all in these coverage surveys. The other tool that we use in many of these surveys is a rapid test kit. It can just tell you what Gregory already showed earlier. It's either turning blue or it's not turning blue. Does it have iodine or does it not have iodine? But we can't really say how accurate is the measurement, the amount of iodine in the salt. And the age of the data, we observe that a lot of the data is older than 10 years or 5 to 10 years old. And at the bottom, the little table there, which is quite important, and you see that the red, the yellow, and the green boxes shows that iodine status, for when the iodine status is actually what we call sufficient, we see that in those countries, the household coverage in 80% of the 19 and 60 together, actually 80% of those countries actually have a poor coverage of the program. So you actually make a misinterpretation if you only look at the iodine status. Next slide. So the dependence on the national service for program performance is really problematic, as I explained. Routine monitoring is weak. The surveys are used basically for program monitoring, trying to figure out where the issues are, what the problems are. And also, we don't really combine these two databases that we have at hand, the iodine status and the coverage of iodized salt. If you look at those global databases and maps, it shows you the colors, but if you would put them on top of each other, you get a different picture. And the equity dimension is not really included in many of this analysis. So what happens is that decision makers see that the country is actually doing well, judging on national averages, but in fact it's not. That leads to complacency. And what we see, this is a long-standing program and has not been well integrated. So we really face a reduced attention and slipping of performance. Next slide. So that is why we decided in the Iodine Global Network to see how can we get away from this dependence on surveys for oversight and look at sentinel monitoring and surveillance to generate more timely data on coverage and iodine status using FORTIMAS. So making sure that program managers have the right information on the state of the program to drive the corrective action and optimize data collection, design, and use. So with the support of Ibrahim Parvanta, we are looking at how we can use the FORTIMAS model to look at countries that actually are nationally sufficient. How can we look at subnational level to identify the spots, the areas where things are not going well? And also, how can we basically look with countries with all the data? How can we update the current status on the program coverage and the iodine status? And how can we use that to inform program adjustments and to track the improvements that are put in place? Also, we want to look at how to track coverage of household salts versus salt as being used in processed foods using market data. And also with the FORTIMAS model, as I think Gregory also explained, is you can really purposefully target certain areas where you expect a problem. So you can really zoom in on those areas, identify what's going on there, and identify corrective measures. Pregnant women is really the main population group from iodine deficiency perspective. So we also look at how you can use antenatal care facilities for testing of urinary iodine. And a recent study and surveillance was carried out in Sri Lanka, and the results also look very similar with national survey data. But also use the FORTIMAS for monitoring early warning of potential threats to the iodine status and to the program due to changes in the market distribution of iodine salt supply. For example, the importation of premix, which is now being at a higher risk because of the global situation and the developments. Next slide, the last one. So not last but not least, is country stakeholders it's important that they take the lead role, and that IGN and others, they are in the support role. And the next step that we are having at IGN is to finalize the FORTIMAS guidance and to pilot test it in a number of countries, which we are doing, which we're preparing at the moment, and also work with other partners to exchange our experiences and see how we can replicate this and combine this for other fortification efforts. With that, I thank you very much for your attention.
Thank you very much, Arnold, and thank you for this presentation and also for sharing the experiences in using this methodology. We will now move to the second Q&A session, and all the speakers of today will be participating in this session. So even if you still have questions for Quinten or for Ibrahim, please share them in the Q&A box at the bottom of your Zoom screen, because they will also be able to answer your questions if they can open the videos, which I think they're doing now. So just to start, there is a question from, well, first of all, there are many questions about where can I find more information on this methodology? And I just want to alert you that a link has been shared in the chat on the Smarter Futures website, where you can find more information on FORTIMAS methodology for all of those who have addressed these type of questions. Then there is a question from Linda Lester, and I think this is a good question maybe to ask to you, Arnold, is whether it would be more cost effective to target women of childbearing potential for monitoring the impacts of these programs. And I think you already hinted to that in your presentation. Can you elaborate on that?
Yes, I think that makes complete sense to look at women of reproductive age, and pregnant women are being selected in these surveillance tools because often pregnant women, to include them in surveys is much harder because there are fewer women as part of the total population that are pregnant. So to find them, you need a very large sample size. And I think what Abe also explained, with the purpose sampling, you can actually identify pregnant women. You can search for them in the antenatal clinics. Of course, you need to keep in mind, who is actually going to the antenatal clinic? When are they going? So that you also know who is represented in those clinics among the pregnant women population. But I think it makes complete sense. And also the target for many of the fortification efforts are women of reproductive age before they become pregnant, to get them into good micronutrient status. I don't know if that answered the question.
Yeah, I think so. At least it's clear for me. And if there are additional questions on this, then please write them down in the chat. There's a second question also from Linda, and I think that's a question more for Quinten about, you were referring to some technical issues, and I think that's maybe is illustrative of the type of technical issues that we can expect to happen in the lab that caused these very low urinary iodine measurements. Can you expand on this issue, or what caused this technical issue? And you're muted. Can you unmute yourself? Sorry.
Actually, my area of expertise is basically on flour and flour analysis. I have not done much on the quantitative measurement of iodine in iodized salt. It's relatively easy, I think, using a chemical method of titration to measure that. It's the old-fashioned way, and usually it may be an easy way to set up systems in existing food control labs to be able to measure the iodine content quantitatively using the classical methods. It's certainly on the flour side, atomic absorption, and there is also a ashing chemical method to measure iron and using chemistry as opposed to atomic absorption. So there are the old-fashioned methods that are tried and true over the years, but it is a bit of a challenge. Also, the other thing is the training of technicians in many countries. And one of the other challenges that we run into with measurement of adding micronutrients to flour is the technology that has become more and more expensive to be able to measure micronutrients in flour, particularly of the vitamins. Vitamins are a real challenge.
Yeah, and that actually also relates to the question that was addressed in the first Q&A session, right? Of the importance of developing national capacity to do these sort of assessments, and also maybe of developing further these type of tools such that they can become available at lower costs.
I would like to add that having traveled through a number of countries around the world, that donors have this tendency to say, oh, well, we'll give you these complicated methodologies and this expensive equipment, and it ends up in a lab. And sadly, I've been in a number of national laboratories where equipment like spectrophotometers, atomic absorption are sitting under dust covers, because either they don't have the capacity to run them themselves, or there's a problem and there was no funding provided to maintain the equipment.
Right.
And that is a real challenge in a number of countries.
Yes. There is also a comment actually in the chat box. I would like to encourage everyone again to answer your question, to address your questions in the Q&A box, but there's a comment by Philip Randall on something that I think you presented, Arnold, on one of your slides, that the sharing of information and a weak coordination of stakeholders, that is really are some critical issues. And that also brings me to another question on, what are your experiences? And I'm not sure, maybe Gregory, maybe you can elaborate on that, because you've been applying this methodology already in these two countries. So what are your experiences with stakeholders' willingness to share data? And particularly, I think, the private sector's willingness to share data. Can you elaborate on that, Gregory?
Yes, that's actually a very good question, and in two countries where we were basically not dealing with the private sector in terms of getting this information. For example, like in Georgia, all information about, because it's completely 100% importing country. So information came from the government, from the customs. So the customs gave us how much from each country. So it was quite easy. And in Turkmenistan, it was also quite easy. They had only one salt producer, which covers almost like 100% of the whole country needs. And it's also the government owned. So again, the government provided all the results. So, but that's kind of maybe an exception. In other places, it might be quite challenging, you know, to get this information, especially in countries where there are many small salt producers or, you know, any other producers which are producing fortified food.
Yes, thanks for that. That is, I think, a challenge we all need to face and solve to better learn how to collaborate and trust and share data with each other. There is also a question from Louise Abayomi. I hope I spell your name, I pronounce your name correct, Louise, about whether there have been any assessments on the impact of iodized salt or other fortified commodities using this methodology in school feeding programs, or for instance, in refugee camps. So in addition to the data that was shared on the general population of women of reproductive age. I'm not sure, Arnold or Gregory, you have any, or Ibrahim maybe?
Yeah, I can answer that. So far, it has not been used in any of these type of settings, refugee camps and so on. It has been used, a little bit at the national, but it could certainly be adapted to that type of setting if needed. Yeah. One other point I'd like to just make regarding the sources of data, from the private sector versus government and so on. Two things. First of all, I went in very deep, very quick overview. The point is, at each country, that's why we call it a methodology, which has to be adapted under each setting. And we don't rely necessarily on one source of data. You can, it's a matter of triangulating information from different sources to see if things make sense. And if they don't make sense, then you investigate a bit more. And then the other part, as I mentioned in my presentation about the role of the private sector, one of the hesitancy that I found when we did the workshops for the countries, the FORTIMAS workshop would bring in the private sector, the government sector, the public health, the regulatory agencies together so we could describe the methodology. It was interesting for me, at least from my experiences, and maybe Quentin can elaborate a bit more. At first, in the beginning of the workshop, which is basically like a 4 or 5 day type event, to go everything into detail, there's hesitancy on the part of the private sector to say, oh, how much? But by the end, when they see how the data is used and when they realize that they are actually the implementers of the intervention, that is the other key. We have to understand and acknowledge that the food producers, if you will, or the importers, they're the ones who actually deliver the intervention, not the Ministry of Health. And if once they realize that they are the ones who are defending or protecting their population, then they become, and how their data would be used to show that, they become much more willing to provide information. And the other key on that is that once the results are done, one of the complaints I've had is that we don't regularly acknowledge them, and we write do publications, we do not put them as co-authors. Yeah. They're the implementers. They should be there somehow.
Yeah, so I think it all comes down to making sure that we can demonstrate what's in it for all the different stakeholders and what they will get out of participating in this process, because basically that's what it is. Christophe, you want to add to that?
No, I wanted to ask Abe because he mentioned about a 4 or 5 day initial workshop, just for people to have an idea. The wealth of work that's needed to implement the methodology. Could you talk to that? There's this 4 days workshop, and then what else? How much work does that represent?
Yeah, so just briefly, the workshop, let's say 4 to 5 days, that includes presentations, discussions, some actual site visits to look, between in the private sector, the public sector. In a number of countries, to be honest, even people from the Ministry of Health were absolutely, they had no idea that hemoglobin data is available, for example, in their antenatal care facilities. It's sitting there, or neural tube defects data is in the records. They are not reported, so they see that. So there's this, there's that part of it. So, and then based on that 4 or 5 days, usually we come up with an initial idea of kind of what the structure of this potential FORTIMAS approach might be. And then obviously over a period of weeks and months, depending on how quickly and people work on it, the system or the structure is a bit more finalized. And then we do initial round of pilot data collection to see if it all works, and then adjust it accordingly, and then go on into the formal data reporting, if you will. I don't know if that helped you, Christophe, but that's basically it.
Yes, thank you. And one final question, and I think it's again for you, Ibrahim, or perhaps Quinten, I don't know, one of the two of you, which is about this methodology of using the sentinel sites sampling, which I think is also a new element in this methodology that's not often being used. So one question from Sergio Moreno is which are the parameters to calculate how many of these sites do you need in one particular country? Or is this just going to cause us a statistical course that you can't really respond in 3 minutes, Ibrahim? Well,
I would just say that it really depends on how much money you have. And that includes surveys as well. As random surveys that we do, representative surveys, is how much money and resources we have. You have to really put things together. Like for example, in Georgia, as Gregory presented, basically they thought that 4 different sites would be sufficient, and it worked out. And based on all the other information we had, I cannot go into all of those details now. It's looking at the situation, looking at the information, and see how things kind of link. It's putting it all together. It's not sample size calculations or any statistical. It's basically looking at it at the information and seeing what would be the most feasible approach based on resources and what would give the information that's reliable. And in Turkmenistan, they decided to do, they have only 5 or 6 regions. So they decided to have, one in an urban and a rural type sentinel site in each of the regions. They had the resources at the time to do it. Yeah. Well, thanks. Yeah, so it all comes down to funding in the end. And I think but it shows, the kind of interest that is in there. And I do see all the other many questions in the chat for more information. So I definitely would like to alert you again to that site at Smarter Futures website. And also there are questions about public, are there any publications? Christophe, maybe you can briefly answer that. Are there any publications that people can turn to which describes this methodology or the experiences with this methodology in more detail?
Sure. So they can turn to the Smarter Future website, obviously, and they can turn to myself, Abe, the people at TUFAS, or even Quinten, obviously, who's been involved. I think we'll be presenting a slide after this ends with our contact details, so they can reach out to any one of us.
Yeah, because I realized that there was also many questions in the chat that we will not be able to answer, unfortunately, due to the sake of time, including a couple of why would we want to focus on micronutrients, which, of course, as the director of Micronutrients Forum, I'm dying to give you that answer, but we will be addressing those through other means, and don't hesitate to contact us. One final question to Gregory, and this is also, I think, related to the current crisis that the world is facing in Ukraine, and is this affecting the import of iodized salt in Georgia? Oh, I think you accidentally clicked away. Maybe Arnold, can you answer that question?
We looked into that and at IGN, and Gregory also checked with the country colleagues, and they have actually started to procure salt from other countries. But indeed, the supply, because Ukraine is one of the main salt producers for the region, and so they countries start to procure from other countries like Turkey and others. And Gregory is back if you want to add something, Gregory.
Yeah, I agree. Yes, that's the case. Fortunately, there is enough salt producers in the area. The impact which is, I think, more serious, is that Ukraine salt was incredibly cheap. Yeah. So for the region, so all other is much more expensive, like 2-3 times. So that may be an issue, especially for iodized salt.
Okay, well, thanks to all the speakers and also now panelists of this session. And also thank you to all the participants for all your questions. It's clear that this is a methodology that is of high interest to you all, which I think is very encouraging, particularly for the organizations that have been involved so far. And I'm sure that there will be follow-up on it. So I would like to welcome you to watch the websites of the organizations that are involved in this webinar. And I think, just to give you some few takeaways from the webinar, what we've seen is that this methodology FORTIMAS can offer important benefits in the context of large-scale food fortification programs to give quick answers on progress of these programs that are, it's less expensive than the traditional methods. It makes use, and it makes actually a smart use of different data sources, and therefore I think it's of such high interest to programs. The Sentinel sampling methodologies, there are quite some questions about it, but it is also a methodology that's clearly of interest and that could be employed more often, especially also by targeting districts, either districts where there's high coverage or districts where there's high need or that have a poor socioeconomic status. However, there are also some challenges, I think, being mentioned and being discussed. It still, I think, leaves the big question on how can we reach the hard to reach. And I think Ibrahim was also referring to that in his presentation. And this is a process that with stakeholders that needs to be aligned. And I think it's a process that really require clear collaboration, sharing of data, trust of each other, but also the assessment of the quality of data that needs to be taken into account. And I think the point was raised that this will require technical support throughout the process, or technical capacity building throughout the process, all the way from improving lab capacity, but also improving, I think, the ability to evaluate quality of data. So I think most importantly, this demonstrates again the need for better capacity to assess the impacts of these type of programs on micronutrient status. And then it brings us back to the importance of addressing the micronutrient data gap, which remains a big obstacle in many of these programs. And the use of data that's been collected through regular health services can definitely be an interesting way forward to help solve that data gap. And in that regard, it's also maybe good to mention that the Micronutrient Forum, with funding from the Bill and Melinda Gates Foundation, has recently launched the Micronutrient Data Alliance, or DINA, which is a platform set up to address this micronutrient data gap, and an alliance of various members to improve the availability, the quality, the accessibility, and the use of data across the entire data value chain. So all the way down from quality of programs to impact, to support national level decision makers to better design, implement, measure, and optimize programs and policies. And this platform has just been launched, and more information will be available soon through the Micronutrient Forum websites, and of course the websites of all the partners that are working on this and that are presenting here also in the webinar today. But the DINA platform will be working on 8 areas, which includes metric specification, the refinement of data and filling of the data gaps, sharing of best practices and lessons learned in the use of data and new methodologies to help guide programs, which is what we've seen here today, to foster and facilitate data sharing, which was addressed also in this webinar, which is critical if we were to make better use of existing data, support and disseminate the results of global data analysis that are relevant to micronutrient advocacy, and to promote investments in data collection and advocate for the systemic use of these type of data at national level. And finally, to focus on gender and vulnerability. So there are many important conversations that are happening about fortification at the moment. It's a topic that is in high demand and high interest, and unfortunately also many countries and donor organizations committed to scale up this much needed interventions. So we welcome you to join us in the conversations on social media with Future Fortified and of all the organizations that are presenting today's webinar. And you can find more information on next Future Fortified webinar series at the link that Kristen is now sharing with you through the chat. So with this, I would like to close the webinar and would like to thank you all again for being present here in the webinar today. And we look forward to welcome you at the next webinar again soon. Thank you very much and have a nice day.
All my love, side to side. All my love, side to side. This is how you fall in love. Let go and I'll hold you up. So pull me tight and close your eyes. All my love, side to side. Scratching out the days in my wall till I see ya. There's a spider on the ceiling scurrying through my dreams, whispering, see